Good morning and welcome to the 2021 Health Policy Conference, Increasing Equity and Access Through Insuring All Tennesseans. We have a terrific lineup of speakers for today's session, which is addressing enrollment gaps and navigation for underserved communities. This webinar is brought to you by the Tennessee Healthcare Campaign. My name is Judy Roitman and I am the Executive Director. The Tennessee Healthcare Campaign is a nonprofit, nonpartisan organization working for over 30 years to promote healthcare justice in Tennessee. We believe that all people in Tennessee deserve access to affordable, equitable, quality healthcare. We advocate for programs and policies that improve the health and well-being of Tennesseans. As we enter the worst period of the COVID pandemic in Tennessee, our work is more vital than ever. If we've learned anything, it is that we are all in this together and we are all essential. Hundreds of thousands of Tennesseans cannot afford health insurance in the middle of a pandemic. The disparate access to care is having tragic consequences in rural areas and for communities of color. The Tennessee Healthcare Campaign is responding to the crisis with a renewed push for Medicaid expansion. We also broadened our health equity work to include access to vaccines for underserved communities of color. In addition, we launched Enroll All Tennessee, a nonprofit insurance agency helping people get the best coverage for the lowest price in TennCare, healthcare.gov, and community resources. We are small but mighty due to the incredible commitment of time, talent, and resources by our many volunteers. If you are new to the Tennessee Healthcare Campaign, I urge you to check out our website and sign up to get involved. We are fortunate to have the support of some wonderful sponsors for today's conference. Please join me in thanking them for their generosity. Rhythm Health, our founding parents, Tony and Madeline Garr, the absolute pillar of our current efforts, Randall and Merrill Rice, TADIS, the Tennessee Association of Alcohol, Drug, and Other Addiction Services, and the United Auto Workers Region 8 and the United Auto Workers Tennessee Community Action Program. And here's a video from them.
The United Auto Workers Union, under the leadership of Regional Director Mitchell Smith and Assistant Director Tim Smith, and all of our members, we wish the Tennessee Healthcare Campaign a successful conference. The labor movement believes that quality health care is the right of every worker, not just the privileged few. So we endorse Medicaid expansion, recognizing it is essential to the state's economy to preserve access to care for every Tennessean and to ensure a healthy workforce. We urge every union household to add their voices to the call for Medicaid expansion. We strongly call on our state leaders to listen to their constituents and to take advantage of this great opportunity.
I would also like to thank these sponsors, the National Association of Social Workers, Tennessee Chapter, the League of Women Voters of Tennessee, NAMI, the National Association of Mental Illness, the Interfaith Worker Justice, Jobs with Justice, East Tennessee, the Peacemaking Committee of the Presbytery of East Tennessee, Planned Parenthood of Tennessee and Northern Mississippi, SOCM, Statewide Organizing for Community Empowerment, the Nashville Labor Council, June Roston, Neil McBride, Rich Hennigan, Nina Gregg and Communication Resources, the Knoxville Oak Ridge Central Labor Council, and a host of incredibly generous individuals. Thank you all for your support. To get started on today's webinar, I'd like to introduce you to today's moderator, Jacqueline Dalton is in her third year as the Tennessee Healthcare Campaign Board member. She serves as board secretary and the chair of the Education and Conference Committee. She was a presenter at last year's annual conference and is serving as our moderator today. Jacqueline works at the National Nonprofit Health Leads as Director of Community Engagement. She's a Middle Tennessee native with a passion for health equity and public health. Thank you, Jacqueline.
Awesome. Thank you, Judy. And I'm so excited to be here today and just thank the board and my colleagues at THCC for having me as today's moderator. Today's session, I just want to say a little bit about our theme, addressing enrollment gaps and navigation in underserved communities. As Judy mentioned, these last 18 months have been a trying time, and the pandemic has challenged us in ways we never imagined. And similarly, we've been thinking about how to support the health of those most impacted by health inequities and health disparities more and more effectively than ever before. So today, during this session, we'll get a glimpse at the work being done on the ground by other colleagues at the Tennessee Healthcare Campaign, as well as a look at what's happening with one of our most critical programs to support those who need access to care and getting it, our state Medicaid program, which we know as TennCare. So without further ado, I'm going to begin by introducing our first presenters today. An exciting presentation. And on the screen here, you see just a slate of all our presenters. Apologies. Yes, all of our presenters today, as well as we'll have a few trainings around volunteering with Tennessee Healthcare Campaign, how to make relationships with policymakers, as well as how to partner with a focus on health equity. Thank you. And before we get into all of that, I do want to just go over quickly. I almost forgot because Zoom is it seems like I could run a Zoom call in my sleep. But for those who may not be familiar with Zoom, we do ask everyone to stay on mute during the presentations. If you have questions, put those in the chat or use the raise your hand function and we'll come to you. If you need to come off of mute, we can do that if you have your hand raised. So just a few arrows to point out whether you'll know whether or not you're on mute, because that icon, the little microphone icon, will either be unslashed or slashed with a red indicator if you're on mute. Otherwise, you can look for that little chat box function and put your questions into the chat, comments as well anytime during the sessions. For our training sessions, when we go into breakout rooms, we do want you all to participate. So feel free to come off mute, engage in the conversation, and ask questions to the trainer at that time. So please feel free to do that during that time. That's all of our Zoom logistics. So now I'm going to introduce our first presentation. We are pleased to have Byron Elam and Tom Savage, who came on to THCC earlier this year when we were looking at how are we going to address enrollment inequities and disparities in the rural areas of Tennessee. So it's been our pleasure to welcome them to the THCC team, both Byron and Tom. Well, Byron, I'll start with you first. Byron Elam is THCC's Vaccine Equity Program Manager, and his work has focused on promoting COVID-19 vaccination in communities of color in rural West Tennessee. He's a resident of Jackson and a graduate of Union University. Byron is encouraging local leaders to break down the barriers to vaccination for community residents. While Tom also encourages health insurance enrollment in rural communities of color in Middle Tennessee as THCC's volunteer and enrollment coordinator. He's also a retired UAW organizer and brings a wealth of labor and civil rights experience to his work. So while both are promoting health equity through their work for the Tennessee Healthcare Campaign, we hope today to just get a glimpse of what that work really looks like on the ground and what are the challenges that they're seeing in addressing that work. So without further ado, I'm going to turn it over to Byron and Tom.
Good morning, and thank you very much for that introduction. As Ms. Dalton said, my name is Byron Elam, and I serve as the program manager for THCC's Vaccine Equity Program.
And good morning. My name is Tom Savage, and I'm excited about the opportunity to work with the Tennessee Healthcare Campaign. I am the volunteer outreach coordinator, and it's my job to steer people the right way and to educate and motivate about the Tennessee Healthcare Campaign and to inspire the uninsured to get insurance. So happy to be here, and let's get started.
So Tom and I will be presenting some of our work. Of course, I work in the arena of vaccinations, particularly COVID-19. Tom works to encourage health insurance enrollments. And so you may ask, well, what do these two topics have to do with one another? Well, Tom and I have discovered that, first of all, we seek to serve the same type of communities and populations. And we have found that in our work that we have discovered very similar themes as we approach both the barriers to enrollment as well as vaccinations, particularly COVID-19 vaccinations.
Insure All Tennessee is truly exactly what it means. I've come to know this number 844-644-5443. When in doubt, you got to say that number. But if you do dial that number, you're going to experience some wonderful counselors, Andrew Hawkins and Merle Wu Price. They do a fantastic job in enlightening Tennesseans about affordable health care. And not only that, they go over and beyond their call of duty. You know, oftentimes when people call you, it seems as though they want to get you off the phone. But Merle and Andrew are so experienced that a survey from them would get rave reviews. They address TennCare and Cover Kids and all that the Tennessee Healthcare Campaign advocates for, TennCare, Marketplace. So excited about them, and they do a fantastic job.
So you may ask regarding vaccine hesitation, information I'm going to share with you where it comes from. Most of the information comes from two listening sessions that the Tennessee Healthcare Campaign held for unvaccinated individuals. The first was done in Morristown, Tennessee, and it was done all in Spanish in partnership with an organization called Ola Lakeway that works with the Hispanic and immigrant populations in that area. We held a second listening session in Jackson, Tennessee, done in English. And both of these listening sessions, like I said, were comprised of all the participants were unvaccinated. And we were able to hear from them about, some of their reasoning behind not getting vaccinated and some of the factors impacting that decision. So here are some numbers regarding vaccine hesitancy here in the state, in particular the African American and Hispanic populations. As you see, the percentage of vaccines administered to African Americans and Latinos is disproportionate to the percentage of their population. So we do have some inequalities and inequities in terms of communities of color receiving the COVID-19 vaccine.
This slide addresses the uninsured. And as you look at the graph, you can see that 0% on the federal poverty level, a childless adult, really nothing going on there for him. And then at Medicaid, the two individuals limited to specific low income groups. And you'll find that TennCare would be associated with that group there. And the one in the middle is no coverage at all. And this is the concern of the Tennessee Healthcare Campaign. Tennessee has, due to the $1.9 trillion rescue package, there's $900 million that's there for Tennessee to be devoted to healthcare. And as you can see here, there's the gap is what we talk about, the uninsured. And so we're looking at folk from age 20 all the way up to the age that they step into Medicare, where of course we understand what Medicare is, but the gap group is of a concern, and it really affects our community. So many of our people have never been to the doctor before. And so when they go to the doctor, you'll find that their situation is really grave. The marketplace is where you will find Andrew and Merle. The marketplace is actually affordable right now due to monies that was from the rescue package. We have some stories that we'll be happy to share with you. One young lady was able to get her insurance for $2 a month. And I shared this with Director Roteman, and I thought I would get Employee of the Month for that, for directing that lady to Andrew for $2 a month. But we found out that Merle Wu had helped someone get insurance, Merle Rice, sorry, Merle, for 45 cents a month. So no doubt she got Employee of the Month for that. But anyway, all jokes aside, the gap area is to be addressed. And that's why we're doing a full court press on for support through advocacy and anything that we can do to fill in that gap, because it is necessary for those that are hurting without insurance. The uninsured, as you can see on the screen, it says all groups, all ages, 10.1% uninsured, men 11.6%, and women 8.8%. As we break it down to the demographics here, 9.4% white Caucasians uninsured, 10.8% African American, and this huge tower indicates our Hispanic community, 34.2%. And as we move to the right from my screen, you can see that 19 and under, 5.0% uninsured. And we're probably, TennCare would probably come into play there. But now as we step on over to the next slide, not the next slide, but the next number is 16.1%, we can see that we're dealing with the uninsured 19 to 25. They have stepped out of TennCare. And 17.9%, 26 to 34. The numbers go down a little bit as we get older, 35 to 44. And then 13.9, we see a few percentage points going down, 45 to 54. 10.6, 55 to 64. And 65 plus, 0.5%. And most likely we are stepping into Medicare. There's a hidden figure in all of this, and I want to show it to you on the next slide. Uninsured rates of Black Tennesseans. And I would want to say this also, I failed to say it earlier, that the insured folk, as long as you are documented and a legal resident, you can be insured and a citizen. But as you can see, the colors here, the darkest color indicates that over 20% of the people in that area are uninsured. And you can see as we break it down, actually in 3 divisions, that West Tennessee, Byron is doing dual duty there, as he is doing vaccine hesitation and also enlightening folks about the need for insurance. And so many of the people in that area do not have adequate insurance. As we work our way to the middle, you can see that even in the county that I'm in, Putnam County, 15 to 20% uninsured. And there's a little county up there on the county line. I know the numbers on it, but it's Clay County. 22% of those folk do not have insurance, and also they don't even have a hospital. Most of it's due to the infrastructure. There's no companies there that provide insurance for their employees. And basically, everything is mom and pop shops where, it's a service industry, people, restaurants and individually owned businesses. And as we go work toward East Tennessee, we can see that the numbers are orange and that deep purple, which is problematic. We just had an event there in Hamlin County in the Morristown area. There's a need for healthcare there. So in essence, what I'm saying is the rural communities are really suffering. There are legions of people who are uninsured, and it's the job of the Tennessee Healthcare Campaign to give them insurance freedom. And that's our task, and that's what we're up to.
So when we disaggregate the data on the sole criteria of race or ethnicity, Hispanic and African American communities in Tennessee are the least likely to be insured and vaccinated against COVID-19. And there's some really strong connections between being both uninsured and unvaccinated. The Center for Disease Control cites in one of their studies that medical providers have a key role in an individual's decision to vaccinate, but they are probably the most influential factor in someone's decision to get vaccinated who is hesitant. So if you are uninsured, of course, you're less likely to receive the care of a medical provider. So these two issues of being both uninsured and unvaccinated, unfortunately, are deeply, deeply connected. So in those communities like Tom was talking about, where you see a low or a high uninsured rate, it puts the entire community at high risk, particularly as we deal with a pandemic.
Byron, may I interject on that just a little bit? And as he was saying, those last two examples, the uninsured are a lot less likely to receive the care of a medical provider. That is true because people of color, they don't go to the doctor in most cases because of lack of insurance until they do get sick. And usually they get a little bit of bad news when they get there. They haven't done the preventative maintenance on their body to take care of them. But lack of insurance does put the entire community at risk. 13% of all the people in America are African American, but we found out that the pandemic affected over 51% of our population. And so that really says that due to the pandemic, the pandemic actually identified the underlying illnesses of the people in the Black and brown community. And with that, we're talking about heart disease, hypertension, kidney disease, and diabetes, and all of those things that it seems that people in the Black community are, those illnesses are latching onto their bodies. And so the pandemic went right to those illnesses, and that's why deaths were disproportionate in our area. Thanks.
Tom and I have identified three key themes that we've heard and recognized in both of our areas of our work and talking with the people that we're trying to serve. Three key reasons that we keep hearing over and over again for people not to be vaccinated against COVID-19 and to not be insured. First reason we we found is there's an information disconnect in many of these communities. They're receiving information from, I would say, inaccurate or unreliable sources. They're not receiving accurate information from reliable sources that they can trust. Number two, there is a distrust of the information that they receive, however accurate it is. And that's for a whole plethora of reasons, particularly historic oppression or instances of abuse. Unfortunately, that is, the history of our country, which still impacts these communities today. And so they distrust a lot of the information that is given to them, despite how accurate it is. And lastly, they don't hear a lot of information from people that they can relate to, people that look like them, people that share their experiences, and that would encourage them to trust the information that is being shared with them.
I think it's exciting about the work that the campaign is doing, because lack of motivations from relatable sources, people in the Black, Indigenous, people of color community, they really have not got the story. They've been so busy working 2 jobs and things like that. And so they hadn't had time to think about it. And that's why I think that the work that the Tennessee Healthcare Campaign is doing is so valuable, and the work that I'm doing and Byron's doing, as we have been directed to get out there in the communities that we live in and enlighten people, to get those volunteers to talk to people, to find the key folk that the people would rely on, and their conversation would be valuable. Churches and community leaders, that's the way that we're going to overcome this, and that's what we're doing.
So we've been over a whole list of problems, and we would like to lift up some solutions that we have identified. First being, know your audience. One size does not fit all. One universal message is not relatable to everyone and to all the populations and diversity across the state. For instance, in one of our listening sessions, we showed a video that we thought would relate in particular to the people that we had at the listening session, and we were wrong. Quite frankly, they did not like the video. They were, quite frankly, offended by it. And we would not have known that unless, which takes us to point number 2, we heard from them. We talked to them, had conversation, we did not assume that we knew what was best for them or what they were related to. We actually talked to them and heard from them, and we were able to identify that was not the right way to reach that particular audience. And the only way you can know that is by speaking to and hearing from the people that you are trying to serve. Number 3, empowered, trusted sources of information to speak to the people that know and trust them. It's hard for instance, this organization just to go into communities and just, we know our information is helpful and could potentially help people and save lives, but we have to recognize that we don't have roots and connections into all of the communities that we're trying to serve. So it's important to identify the folks that are already there in those communities, that have been there, that have a track record of service and love for their communities, and people trust them, and empower them to share information that could potentially help their community. Lastly, have people tell their stories. Sometimes people think that, what they're going through is, other people have an experience, but as the numbers suggest, vaccine hesitancy in communities of color and lack of health insurance enrollment, it's unfortunately a widespread problem. And so I think when you empower people to tell their stories, people realize that they're not the only ones, and that they feel more empowered to make the right decision to get vaccinated or to pursue health insurance enrollment.
I would say also on this, when you guys, I wish you could have been with us when Byron and our director, we went over the little video that he did, and the people rejected it. Actually, they were offended. But on the flip side of that, it was a teaching moment for us, but also it did a lot of people would actually like that. It was the video of a rapper singing his song, and it was fun, but it was on this particular night, it was the wrong audience. And just being real, I have friends and relatives who would still be dancing to that right now, and it would probably direct them to get a shot in the arm. But you do have to know your audience, that's for sure. So that was exciting, and the storytelling part is truly important. I was looking at the presenters and today, and so there's a lot of people who are educated people would actually be moved by Dr. Jennifer Erves, assistant professor at Meharry Medical College. But then again, people would be moved by a rapper. So we just gotta, we're kind of like doctors, and we gotta give the people the prescription that they need that would get a shot in the arm or get them insured.
So with all of the problems and solutions that we've shared with you so far, of course, THCC is an action-oriented organization. And so we are actively trying to do something about all of the problems that we've shared and apply some of the solutions that we have. Regarding vaccine equity, our vaccine equity program includes, the strategy is to help train frontline health staff to be culturally competent and sensitive. And so when they're serving vulnerable communities, to be better able to be sensitive and competent and culturally competent, so that they can help to encourage the people that they serve to receive the COVID-19 vaccine. We're working to sponsor vaccine events in the communities that need the vaccine the most, and also partnering with local organizations that are already in those communities, so that our work can be bolstered by what these local organizations are already doing. Also, part of our vaccine equity program, we've identified 10 vaccine ambassadors. These are people in each of the communities that we're trying to serve. Our vaccine equity program is targeting 7 counties: Madison, Crockett, Lauderdale, Hardeman, and Haywood in West Tennessee, and Bedford and Hamlin counties in East Tennessee. In each of those communities, we have identified what we're calling vaccine ambassadors. And these ambassadors are people that work and live in these communities. People know them, people trust them, and we are empowering those ambassadors to carry on the message regarding the COVID-19 vaccine. And we're doing that currently by recording PSAs and other type of media that we're going to eventually try to saturate in these communities that we're trying to serve. We are in the process of doing that now. But as you can see in this list of ambassadors, they come from a diverse background and areas of expertise. But like I said, these are folks that belong to these communities. People know them. And so we feel that it is best for them to carry on the message regarding COVID-19 vaccine, and that they would have the most impact in convincing their community members to get vaccinated. Here's a snapshot of a couple of our vaccine ambassadors. We're in the middle of filming PSAs and audio. We had two filming sessions actually yesterday in Jackson, one with a local African-American physician, Dr. Moraney, and the second with the Reverend Curtis Marmon, who pastors a church in Jackson, and he's also a hospital chaplain. So we are developing each PSA and each message according to the background and expertise of the ambassador. And I must say it's been pretty fun to do so far, and we're very excited as we continue filming our vaccine ambassadors. They're great people.
What is the Tennessee Healthcare Campaign doing? Well, it's our time. It's show and tell for the Tennessee Healthcare Campaign as we are approaching open enrollment. We're preparing for open enrollment to maintain our volunteers and seek new volunteers. So things are on schedule right now as we prepare for open enrollment. And also we're grateful for the Christmas present that we have, as they have extended open enrollment to January the 1st. We have really worked hard in open enrollment, and so we increased our numbers 60%. We got that data from Andrew Hawkins and Merrill Rice. And so we're excited about that, and we're only as good as our last year. And so it's our goal and our hope that we will outperform the numbers that we were satisfied with this year. Also, the coalition building is a very exciting part for me being a union organizer. And so absolutely, I went right back to that well, to labor unions, and the director has been doing presentations. She did one to the East Tennessee Central Labor Council. She also did one to the Middle Tennessee Nashville Central Labor Council. And with that, it opened up doors for us to have access to their labor unions. Well, why do we do that? We want to go to their local unions and lift them up and tell them about how excited we are that they have affordable health care that's actually provided through their employer. But we also know on the flip side of that, that they have children, nephews, and nieces that do not have affordable health care. And we want them to be a voice for us. We have resolutions that they have all endorsed, and they have made the commitment that they would talk to their neighbor to enlighten them about affordable health care, to talk about TennCare, to talk about the marketplace, to direct them to the 844 number so they can talk to Andrew and Merle. And so we made that move on the AFL-CIO, which is the Central Labor Councils are under that umbrella. And then we stepped to another organization, the United Auto Workers Union, which has several thousand members in the state of Tennessee. As you can see, they were one of our highest level sponsors, and their director, Mr. Mitchell Smith, has given us the authority to go into their union meetings on their union meeting day to pass out information, to talk to the members and inspire them to lift up another brother or another sister, to tell them, to help them acquire decent health care. So we're excited about that. That's an inroad that I think is going to be very beneficial to the Tennessee Healthcare Campaign. Also, and we continue to talk about vaccines with them too. So Byron and I, we interchange conversation. He helps me and I help him. We're working with local leaders and media to spread information about TennCare and open enrollment. And so that allows us to get into church houses and other groups. I think the director is going to be talking to Rotary clubs throughout the state of Tennessee. And so we're excited about that. And we have done much work that's in our area with local media, doing PSAs, talking to radio stations, had the opportunity to go in and sit down and talk about the Tennessee Healthcare Campaign. That was exciting and really felt good about doing that for the campaign. We're working with local elected officials to secure the support of Medicaid expansion. The plan is not to leave a stone unturned. We are having a series of meetings to have conversation with the Speaker of the House, Cameron Sexton, who actually is in the area. We have had conversation with Senator Paul Bailey, and we have to have that tough conversation and to show them examples and testimonies of people who are suffering from lack of health care. And the hope is that we'll gain their support. We really don't want a secondary program. We want Medicaid expansion, and that's what we're going to stay on that, and hopefully we'll be able to help the citizens of Tennessee be healthcare free. And lastly speaking, telling our stories. Nothing like telling a story. You can talk to someone that doesn't share your values, but if you got a good story, if there's a moral compass to them, you have the ability to move them. And one story that it's a tough story, but it's Scotty's story. Scotty was a young man who really had it going on in life, and his father is an advocate for mental health. Scotty was a lifeguard, one of the greatest chess players around, and Scotty saved a young lady's life as a lifeguard. He dived into the water and got her out and resuscitated her and brought her back to life. But Scotty was suffering with schizophrenia, and under Medicaid at the time there was a provision. There was help for him for mental health, but that program was shut down. And when they shut it down, it really did away with the lifeline that Scotty used. It kept him going and kept him balanced. And later on, Scotty he took his life. But his parents, it motivated his parents. And so they are advocates for mental health, and we want that back into Medicaid. And the next story that we're excited about is Miss Donna Mosby of Oak Ridge. She is a Medicaid ambassador. Medicaid ambassadors are people who are without reproach and well thought of in their communities. And they have skills that really complement the Tennessee Healthcare Campaign and what we're trying to do. Ms. Donna Mosby told us about Wanda, who was lacking health care, and she had hurt her leg and actually went to the doctor. And as they were setting up her appointment, they sprung upon her that in order for them to even administer medical care to her, that she had to have $250. And at that time, she wasn't prepared to pay that. So what we've found out and what I believe is Medicaid expansion would bring about dignity to those who are who have medical problems. Most of the time when we go to the doctor, we go in kind of beat down because we're in fear of not being able to get the medical, the things that we need. In the Latino community, we have found out that there's a difference in the Black community and in the Latino community. The Latino community, when they go to the doctor, their greatest fear is, oh Lord, I'm not going to be able to pay for this. And so Medicaid expansion is the key. And I'm so grateful to have this opportunity to talk to each and every one. And thank you for your time.